Hello, welcome to Look East. Coming up in the programme tonight, the Dietary Divide created by COVID. New research sparks concern for the health of families and the elderly. We'd be devastated. Saffron Walden's traders hope to avoid more restrictions amid rising COVID rates.
I'm on part of a Milton Keynes estate that some describe as hell. On the night, it could move a big step closer to being demolished.
And I'm at Kidney Research UK in Peterborough, finding out the ways in which they're making it through the pandemic.
First tonight, how the coronavirus pandemic has affected the way we eat. New research by the University of Hertfordshire has found that while some people improved their eating habits during lockdown, for families on low budgets and older people, food health has really declined to worrying levels. Struggling to shop, panic buying, loss of earnings, they are just some of the reasons behind it. But with the threat of local lockdown still looming, what can we learn for the future? Kate Bradbrook has been to meet some of those trying to help.
Hot meals delivered to your door. It's not a new idea, but during lockdown, this service in Hertfordshire came into its own.
Very good. We have a cottage pie, stewed apple for your husband. We didn't want to go out because of the pandemic, and we were a bit concerned about that.
My daughter, before the pandemic, used to leave bread and milk on the doorstep for us. But when the pandemic came, my son said, no, you're having Meals on Wheels, as simple as that, Mum. You know, if you don't eat it all, you can have it for tea, which we do quite often. Yeah. But yes, it's godsend.
The meals are provided by the Hertfordshire Independent Living Service, commissioned by the County Council. They deliver to the elderly and vulnerable, and in recent months, they've been busier than ever.
When the pandemic struck and people were required to shield, demand absolutely rocketed, and we were delivering at one point almost 2,000 meals a day just at the lunchtime to make sure that people were supported, and taking out emergency breakfast packs and teas. Very sadly, there are still people who have not been outside their front doors for the whole of this period, so they are truly isolated. So having that daily contact when our teams go in and have a friendly word, make sure that they're okay, do some other little jobs as well, just to make sure that they are protected, is incredibly important.
According to a report by the University of Hertfordshire, COVID-19 has meant the most vulnerable and deprived have seen their diets worsening. This social enterprise is going some way to prevent that from happening.
I think it's a lifeline for them, because sometimes the people that live on their own, we're the only people that they see throughout the day if they don't see carers or family members. People say that, you know, they thoroughly enjoyed the meals. You know, they're always piping hot, and they enjoy the service that we give them.
I could just have the hot meal, and when I do it, put it in the oven at a low temperature, just keep it warm, hot. And then I've got from now till when I fancy having it, sitting down to it, I help myself to it. I've always enjoyed my food anyway, but I do enjoy these delivery meals.
But the report found that this is the exception rather than the rule, with most local authorities not offering Meals on Wheels services. It's recommending that more support is needed so that elderly people in particular can benefit from regular hot dinners. Kate Bradbrook, BBC Look East in Hertfordshire.
Well, let's bring in Professor Wendy Wills, who led this research. Professor Wills, food inequality, it isn't new, but clearly from your research, COVID has had an impact. Is it because of the availability of food or the cost of it?
It's both, really. What we've found is that the inequalities that were in existence before lockdown and before the pandemic became part of our lives have just become amplified, really. So those who already struggled to have enough money to be able to access food have struggled more since March. Those who had enough money in more stable situations have been able to experiment with food, can shop around, can afford the more expensive branded items. Because if you're a family trying to feed several people in a household on a lower income and you're also worried about your job, it's really important that you can still access the kind of lower cost foods that means you can feed everybody. But that just became harder and harder. It wasn't just the panic buying, but just people not being able to get out, having children at home all day who ordinarily would be at school and sort of demanding food throughout the day just put so many extra pressures and really sort of magnified the inequalities that we already knew existed.
And I guess we also know that people were struggling to get food delivered, weren't they, certainly at the beginning. But community groups and charities, the likes of what we've just seen in Kate's report there, they all set up schemes to try to help feed people. Were they just not successful enough in the main?
I think they've done a phenomenal job, actually. What we've found from the research from the University of Hertfordshire is that all the community groups, the faith groups, the banks of volunteers who came forward, local councils, local authorities, really did pull together in a way that we probably could never have imagined a year ago could be so successful. But of course, there are always some people that get left behind. And sometimes some of the food that was on offer through the government food parcel scheme that local councils, for example, were administering wasn't always the quality of food that we would want for people. It wasn't always nutritious. And some councils really pushed back on that because they were aware we don't just want people to get by, we want them to be able to eat well. So although on the whole things worked really well, we'll be concerned about how things might change if we go into another sort of difficult winter when a lot of the people that were volunteering to deliver food, for example, are no longer on furlough. They've had to go back into employment if they're lucky enough to keep their jobs. So where are the volunteers going to come from? It's changing all the time, and that does present a concern for us.
Well, you have made a series of recommendations, basically more of the same, let's do it better. I'm afraid time is against us for now, but I know that a lot of that will be put into practice if we do end up in that position again. For now, Professor Wendy Wills, thank you for your time. Thank you. Now, Uttlesford is emerging as this region's new